ahead.
Hello, my name is
Hi.
Michael. I'm a student pharmacist. Looks like we've got a new prescription here for Robert. Are you picking up for Robert?
Uh-huh.
All right, so looks like we've got a new medication. Uh, so were you okay with counseling on this? It'll take about 5 minutes or so. It's important that we counsel so that you can get the best outcomes for it. Is that okay?
Yeah, that's fine.
Okay. If you have any concerns or questions throughout the counseling, please do not hesitate to let me know. That's what this is all for. So first, I just want to start off by verifying some of Robert's information. Can you verify his date of birth?
4/22/74.
Okay, perfect. And then for the address, I've got 4836 Hickman Road, Des Moines, Iowa, 50314, and phone number 515-271-3898. Is that correct?
Yep, that's
Okay,
right.
sounds good. So, what medications is Robert currently taking?
He takes amlodipine for his blood pressure and occasionally takes some ibuprofen.
Okay. And then any other prescription medications we should be
No.
aware of? What over-the-counter medications is he taking other than the ibuprofen?
Not much.
All
No.
right. What samples, herbals, or supplements is he taking?
None that I'm
Nothing.
aware of.
Okay. And then what other medical conditions does he have? You mentioned the blood pressure. What other conditions does he have?
That's all that I know
Okay. Are you aware of whether or not his blood pressure is well controlled?
of. Mm-hmm.
It's well controlled?
Yep.
Okay. Does he have any past history of heart attack or anything like that?
No.
No. Okay. Good deal. So the medication we've got today is Cialis. So that's the brand name. At this time it's only available as a brand, but the generic is Tadalafil. And so what did the doctor tell you this one was for? Or were you there at the doctor's appointment?
I wasn't at the appointment, but my husband was too embarrassed to come get it.
Okay.
So it's to improve our sex life, apparently.
Okay. So this medication can be used for erectile dysfunction. It sounds like that's what the doctor is prescribing here for today. And then how did Dr. Jones tell Robert to take this medication? Okay.
I don't know.
Okay, so it is Cialis. It's a 10 milligram tablet. He wrote the prescription for 10, and so he's going to be taking one tablet by mouth. And so the instructions say as directed. So it would probably be 30 minutes prior to sex. He'd want to limit this to one per day. He would not want to be taking this more than once a day. As far as what to expect, what did the doctor tell you? Or what do you know anything about what he might expect? Okay, so he should expect that it'll be easier to get an erection during sex, and like I said, it'll take about 30 minutes. So before that takes effect, this is kind of a as-needed medication or as you choose. As far as adverse reactions, there is a very small chance that he could be allergic to this medication. So if his throat swells up or his tongue swells up or anything like that, you want to seek medical attention immediately. So hypertension is also a possible side effect of this medication. That's why I was concerned on whether or not his blood pressure was well controlled. If something happens where his blood pressure is not well controlled or anything like that, he'd want to make sure to kind of talk to his doctor and see if this was still a good choice for this. So it's also going to be extremely important that he keeps on taking that amlodipine every day. Other possible side effects, headache, possible flushing of the face as well. As far as notable interactions, there is a food interaction that's possible. Do you know, does your husband drink grapefruit juice?
No.
No, okay. So if you were to decide to start drinking grapefruit juice, you just want to be careful with that and possibly talk to his doctor. As far as storage, where do you currently store medications? Where does he store his medications?
In the top shelf of our kitchen.
Okay. Away from kids and pets, I assume then? Okay. So yeah, you want to store it in a cool, dry place away from kids and pets. Can you tell me 3 important things that we've gone over today that you might take back and tell your husband?
Only one a day. Might cause a headache or flushing.
Mm-hmm.
And shouldn't affect his blood pressure medication that he's currently on.
So it won't affect the medication, but it could possibly affect his blood pressure. And so that's just something he'd want to look out for. What questions do you have about anything that we went over today?
So he's well controlled now, and this is going to affect it. How did you say? Like
It could,
all the time? or just when he takes it?
So when he takes it, there's a chance that it could increase his blood pressure. So that also has to do with how the medication works a little bit, to help make it easier to get an erection. So he would just want to kind of monitor that and see if he starts feeling his heart rate racing or anything like that. You'd want to let his doctor know about that. Otherwise, the most important thing is if he has any questions, he should give us a call and let us know. We'd be happy to go over all of this with him again. So,
Okay.
thank you very much.
Yep.